Good morning, good afternoon, good evening, wherever you are on the globe, and welcome to the USAID Global Health Local Capacity Development webinar series facilitated by the NPI Expand project. I am Mary Adomensa, Project Management Specialist with USAID Ghana, and I will serve as your moderator today. This morning's webinar, The Way Forward, Locally Led Capacity Building Approaches, is the 5th webinar in our series. We will spotlight partnership models that have localized approaches to capacity strengthening through illustrative case studies. Presenters from T-MARC and PASADA from Tanzania, Total Family Health Organization, and KCL Ghana will share lessons learned from their peer-to-peer capacity building experiences. Speakers will highlight the critical nature of locally led capacity strengthening frameworks, different approaches to locally led capacity strengthening interventions, and how to incorporate these approaches in your own programming. So by the end of this webinar, you will understand 1, the critical nature of locally led capacity strengthening frameworks for sustainable organizational improvement and performance. 2, different approaches to locally led capacity strengthening interventions and their advantages, difficulties, and opportunities. And 3, how development practitioners can encourage and support similar capacity strengthening partnerships in their own programming. So the first part of our webinar features the lead organizations, which is T-MARC and TFHO, who will present on the project or the activity in which they provided capacity strengthening support to the beneficiary organization, which is PASADA and KCL respectively. Then next, PASADA and KCL will expand on the opening from T-MARC and TFHO, providing context on how they perceive the support and how this has impacted their organizational performance and capacity. I will have some questions to help facilitate a conversation after their presentations, and then we'll move to a question and answer session where we'll take questions from you, our audience, to continue the discussion. If you have questions during the presentations, please put them in the chat box, and we'll try to get to as many of them as we can during the Q&A session. Please note that the webinar is being recorded, and at the end, we will share the recording and slides with participants via email. They will also be accessible on the NPI Expand website. Also, we will be tracking attendees and CLPs for USAID staff, and will be offered pending further guidance on the CLP program. So with that, I turn it over to Carla Fosan, Director of the Office of Country Support with USAID, to give the opening remarks. Over to you, Carla.
Thank you for that introduction, Mary. In addition to Mary's role at USAID Ghana, we have the great pleasure of having her currently serve as a Foreign Service National Fellow in the Office of Country Support, where she is sharing her on-the-ground expertise in locally led development with us here in Washington. So, hello everyone, and welcome to those of you joining from Washington, DC and around the world. As the director of the USAID's Office of Country Support in the Global Health Bureau, I am honored to welcome you and to start this series today and to participate in this important discussion. This is the 5th webinar in the Local Capacity Strengthening and Global Health webinar series that USAID is hosting. And today's discussion will focus on locally led capacity building approaches. This series is possible thanks to the collaboration between USAID and one of our new partnerships initiative flagship projects, Expanding Health Partnerships, or NPI Expand. It's part of a year-long series that brings together speakers from USAID and our implementing partners to facilitate discussions on best practices, challenges, and current trends in local capacity strengthening and global health. Localization at USAID focuses on intentional changes and how we work to support partnerships and programs that empower local actors. Today, we will explore how local partners can leverage each other's strengths and capabilities to improve their organizational effectiveness. We see this partnership model as a promising approach to promote collaborative learning across local partners while also strengthening the local health system. USAID has developed workwithusaid.org, a resource hub that empowers new, current, and future partners to navigate how to work with USAID. By visiting the website, you can gain access to a variety of innovative services and curated resources, all designed to improve your local organizational readiness. To promote localization, USAID has also developed a new agency policy that lays out a shared vision for local capacity strengthening. This policy was disseminated for public comment, and USAID is currently working to integrate this feedback into the final policy, which we expect to disseminate in September of this year. So I hope that all of you will plan to also attend the 6th and final local capacity strengthening webinar that we have planned for this fall, and join us in continuing these important discussions. So welcome, I hope you fully participate. Please do share as many questions as you have, and we are so grateful to have you as partners and as participants in today's discussion. So Mary, I hand it back to you to facilitate.
Thank you so much, Carla, for those opening remarks. And I'm pleased to introduce our first two panelists who will share their unique experiences supporting locally led capacity strengthening interventions. So I would like to welcome Alpha Joseph, Marketing Manager, T-MARC, and Joven Mwezi, Project Manager, Pastoral Activities and Services for People with AIDS, Dar es Salaam Archdiocese, all from Tanzania. So over to you, Alpha.
Alpha, you're muted right now. Apologies, you'll just have to unmute.
Hi, hello everyone. Happy to participate in this webinar, and hopefully is going to showcase what we have done in terms of local partnership that existed between us and various CSOs in Tanzania. Let me start by giving a short introduction about T-MARC Tanzania. T-MARC Tanzania is a non-governmental organization established in 2005, initial as USA government-supported organization in response to HIV/AIDS epidemic, and later grown slowly to become an independent NGO with wide coverage in terms of its activities, which includes reproductive, maternal, newborn, child, malaria, adolescent health, and overall focus into Tanzanian, improving Tanzanian society. Our collaboration story comes from 2000, 220 to 2020 to 2021, whereby were approached by NPI Expand Palladium to carry out, to provide technical assistance in business planning and marketing for the production of face masks and soap for 25 Wathiet groups in Tanzania, which were managed by 3 CSOs, PASADA in Dar es Salaam, MOXO in Mwanza region, and NAFGEM in Kilimanjaro region. The objective behind the project was to train the Wathiet groups in business planning and marketing, provide technical assistance to Wathiet groups to develop business plans, and provide technical assistance to Wathiet groups to design and brand products, And lastly was to provide technical assistance to Wathietu groups to implement their respective business plans. We designed a lot of interventions and activities to ensure that we achieve the 4 objectives. One of them was to work closely with the CSOs to understand the gaps that exist at the CSO levels and the gaps that exist in all participating groups. So we developed a TNA, which from there we were able to understand areas of focus whenever we're developing the training curriculum and the training materials to be able to address specific issues. And through this collaboration, one of the intervention which for us was key was to train PASADA employees, the ESLOs and livelihood volunteers on business planning and marketing, so as they can be able to train the Wathietu group members. So instead of us going to train and we walk out, we said we need to ensure that we've given the PASADA staff knowledge enough to be sure to be able to train the Wathietu group members and to continue providing technical assistance even after the project has come to an end. And one of the notable achievement of this project, first, is the fact that we were able to meet all the 4 objectives of the project, but also we were able to develop a brand name for hand wash liquid soap, and we were able to start production and business for hand wash liquid soap. And we were able to identify and train about 618 Wathietu groups members. We trained and provide technical assistance and building capability for all ESLOs and LEVs that work with PASADA. And we over and above developing a brand name, we got the brand name also registered by Tanzania regulatory authorities, and we were able to support the team with various marketing and point of sales materials for them to be able to create awareness of the brand and promote the brand to have easy accessibility and brand acceptability in the market. Yes, there are some few challenges here and there in terms of getting all stakeholders together and delivering all milestone in time. But whenever there was issues, we had a very good system of alignment between all partners, weekly meetings whereby issues and challenges were discussed and solution gathered, and we were able to move forward. So at the end of the day, PASADA were able all 10 Wathietu groups under PASADA were covered in terms of training, and they were able to start production and starting sellings of hand wash liquid soap and the face mask. And to date, they are still continuing with the business, and we are still supporting them from time to time to ensure that whatever we have started is not dying. So though the project has ended, but we're still supporting the team to ensure that the brand continue to be in the market and the Worth It groups are making business and develop. Thank you.
Thank you so much, Alpha, for sharing your experiences with us. We will get back to you shortly with some questions. But next, we want to invite Jovin from PASADA to share his presentation. Over to you, Jovin.
Thank you, and good morning to those who are out of Africa, and good afternoon for the Tanzanian people. So my presentation is going to complement a bit of what Alf have said. For us, after getting the training aimed to make a capacity to the staff, but directing to support with yet groups members, which we are working with them from different angles. So after getting the business training, business entrepreneurship and the business training from T-MARC, we went forward by training some few individuals from the groups where to train a few individuals with the government organization, which is known as SIDO. SIDO is the small industry organization. We're supporting small industry in Tanzania. So we train them to be able to produce hand wash, soap and sanitizers, and also to produce non-medical masks, which were aiming at addressing pandemic, COVID-19 pandemic. So we succeeded. We trained 10. Can you hear me? So we organized the training. Yes. We trained 50 members of WETHET groups. These were received the training from SIDO. 4 of them were trained on how to make liquid soap and hand wash, and 10 of them were trained to make non-medical mask. And after training, we provided them with the startup kits to continue with the business. So together with the business training, entrepreneur skills which were provided with the T-MARC, we were able now, our members of these groups were able to access the local market. And the way Araf have said that up to now, they're still continuing with the market, with the business. They have their brand names and they're able to sell and they record the profit. But not only that, they've been able to cascade to other groups nearby. We were working with the 10 groups, but good enough now we can see that the training have been cascaded to other groups, expanded to other groups, which are nearby or working with PASADA for the time being. So that was a remarkable achievement during this project. But not only that, we have recorded high profit for those groups, and we have recorded entrepreneurship skills which they have up to now. That is very recorded. When you come to the project itself, the implementation of project was based on milestone reporting. This was a new method of implementing the activities in PASADA, and this was it's very commendable and useful, as we have managed to use it to other projects. Why we are saying this recommendable? This seems to be more effective in following up the implementation of the project. You are able now to know where there is a challenge and to address it before completing the milestone. And this, we thank NPI Expand for introducing this method for us. And we are using it, have been adapted to other projects, and we're using up to now. But also another major success we have, our group now are recognized by the government. We have also the Alpha have said, we have the brand name, which are able to access the market, even though they have now at the local level market, we think and we see the opportunity that may be able to access even international market. On the challenge, which I did not put here in my presentation, but the only challenge which you can note, it was a time limit of the project. Project was designed for a few months, addressing one of the challenges which we are facing as a community in Tanzania. So we thought if we have had enough time, we could have been able to do a lot and to strengthen this with theatre groups. Thank you very much.
So thank you so much, Joven, and thank you both. I would have a couple of questions to ask to gain some more information. So first, I will want to talk to T-MARC, and if you could share with us how you went about identifying activities to conduct with PASADA, and a little bit of how PASADA was involved in co-creating or co-designing these interventions. Over to you, T-MARC.
Thank you, Mary. As I said earlier, we received the TOR from NPI Expand, and from the TOR we were able to develop activities to address the TOR, especially the objectives. However, we conducted, as I said, TNA. To understand where exactly are the gaps and areas that need strengthening. But we also had several meetings with PASADA and Wathieto Group's leader to understand exactly the extent of the issues and how best to design interventions. One of the key issues that perhaps was spotted during our engagement with PASADA and Wathieto groups was lots of members' levels of education were low, and most of them were 40 and above. So when we were designing our training curriculum, we said, given the nature of our attendance, audio-visual materials would work perfect well for them. So we used more of charts, graphs, tables, and audio-visual materials to train and make them understand, rather than having a lot of plain text. Yeah.
Thank you so much, Alpha. And I have a question for PASADA. If you can share with us what activities or approaches were the most impactful for your organization, and then also a little bit of whether they were more technical or focused on organizational improvements. Over to you, Joven.
Okay, the good thing, the technical approaches which were used by T-MARC and PASADA together. First of all, selection of the members to participate in these trainings. We are well guided from Paradigm, but also we went further. As Alpha said, many of our members of this group, they have literacy limitation. So we were very keen, but also we used our staff, ESLO, Economic Strengthening Officers, and ROV, these people, these who are teaching or guiding the groups to share to be able to identify the gaps where we needed to strengthen more, especially economic-wise. But also, there was a participatory approach in designing, for example, designing the brand, but also participation in developing business plan. This was done after getting the TOT. These people went down to sit with those groups, in order to develop those business group, the business plan, but also to identify where they want to strengthen more. So that was more technical, which we can say that it was a good approach which can recommend to another project or others. But as I said before, in the program ways, the way we are implementing this project, it was new to us as PASADA. That PASADA used to have a program based on a work plan. But by introducing milestone reporting, we saw that it was very easy for us to follow up with all the activities in the field. Even when we are reporting and also looking at the budget line, it was very easy for us to follow up. So that's why we have recommended that milestone should be cascaded or extended to other projects in order that it can make it easy for us to follow up implementation of the project. I think I've answered your question.
Thank you. So from what I gather, this approach was both organizational and technical assistance. Thank you very much. So for T-MARC, what sustainability measures were put in place to ensure capacity strengthening activities resulted in lasting improvements?
Thank you, Mary. We developed 3 things that we did to ensure that there is sustainability in terms of whatever we have done. One was as we designed the intervention, we designed in such a way that we spent a lot of time with ESLOs and LEVs to ensure that we have strengthened their capability enough in terms of business planning, business skills, and marketing skills, sales skills, negotiation skills, for them to be able to assist the Wathietu groups, leadership and members, even after the project has come to an end. And from the look of things, this has been successful because we check these groups from time to time, and you can see what the way things are moving after even the project has ended is because the ESLOs and LEVs were engaged and strengthened their capability in terms of business plan and marketing. The second thing that we did was after providing technical assistance, we realized there is issues around record keeping and tracking performance. So we developed the performance tracking template for these groups, so as from time to time they can be able to assess themselves to see if they are performing well or if there is any issues that they need to address. And we have been checking the performance tracking template has been so useful for them, and it's really helped them to plan and organize their activities. The last one that we did was, we said we did a lot of we spent a lot of resource in terms of time, energy, and knowledge to train these people. And over and above that, we registered a brand name under our name. So we have been from time to time checking performance of this brand in the market, especially in terms of quality. And from time to time, we have been engaging PASADA and the groups directly to see if there is any challenges. And from time to time, we have been providing both PASADA and the group's technical assistance to ensure that they can still operate smoothly in the market. Thank you.
Well, thank you so much, Alpha and Joven, for sharing your unique experiences. Next, I am pleased to introduce our next 2 panelists who will share their approach to locally led capacity strengthening interventions. So I would like to welcome Joseph Adoyobo, Executive Director, Total Family Health Organization, and Richard J, Managing Director, Casapreco Company Limited, all from Ghana. So over to you, Joseph.
Thank you very
Joseph, you're
much,
on mute.
Mary, and thank you to my thank you very much, Mary, and thank you very much, my colleagues from Tanzania, for sharing your experience. I'm going to briefly share with you an activity that we conducted in Ghana in partnership with Casapreco Company Limited, and how we supported to provide hand sanitizers at the peak of the pandemic in Ghana. So, how did it all start? Ghana, as we might be aware, recorded its first COVID case in March 2020, specifically on the 12th. All of a sudden, we had an increase in demand for hand sanitizers because the message went down well and everybody wanted to prevent him or herself to avoid catching the COVID. This demand was nationwide. And then also we know globally, the demand went up. There's a number of reasons that accounted for this demand. In addition to people wanting to prevent themselves from catching the disease, largely Ghana was dependent on importing hand sanitizers into Ghana. So with the COVID breaking out, countries were using their own hand sanitizers they were providing and were not exporting a lot into our countries. This shortage resulted in price hikes, and then we realized that there is a need for us to do something to respond and also ensure that we have local supply for this essential health commodity. I'll take the next slide, please. Okay, so whilst we wait for the next slide, I think I'll go ahead and tell the story and then you catch up on the slides when it comes. So specifically, what did we do? We worked with Casapreco Company Limited by reaching out to them and telling them, informing them about this opportunity. They were already thinking about this opportunity and were ready to go into the market. So basically, we converge at a point because we all share the same interest, and they also as an organization wanted to do something as a corporate social responsibility to help the situation. So together, we embarked on this journey. We basically provided technical assistance to the R&D, Research and Development Department of Casapreco, and then help formulate hand sanitizers in accordance with the WHO recommended formula. And from there, we facilitated the process of having this commodity registered by the Food and Drugs Authority. Then also, to assure that there is continuous supply, we contracted Casapreco Company Limited to manufacture for us a social marketing brand, which you see in pictures on my right. But the interesting thing is, in addition, KCL also had their own brand that they already put on the market. And I'm glad to say today, they are the market leaders in Ghana. Next slide, please. Well, so as we wait for the next slide, I would just move on and then say that this partnership has been very fruitful. In addition to giving this contract manufacturing to KCL, we also went a step further by applying for funding through USAID's Center for Innovations and Implementation. And we received $800,000 to support this activity in Ghana. And what we did was that out of that, we gave a grant of $150,000 to Casapreco to help improve upon the product. And you hear more of what Casapreco did when they take the next spot after my presentation. We also invested in mass media campaigns and then also invested in retail audits that provided insights into the market. And then we shared all this information with KCL to help improve their brand and inform their marketing strategies on the market. We also facilitated a lot of trade and a lot of business opportunities, linked them to hospitals, linked them to various retail outlets, since they were coming into the health market. They needed a lot of market information to facilitate sales opportunities for a health commodity such as hand sanitizers. So this, in a nutshell, is what we were able to do with KCL over this period. And this has resulted in a huge supply of hand sanitizers in Ghana. We've built capacity that I can confidently say Ghana can be very self-reliant on production of hand sanitizers. And at the peak of the pandemic, a lot of hand sanitizers were supplied by KCL. And amazingly, it drove down the prices. And I'm glad to say that KCL hand sanitizer is still the cheapest on the market and still the market leader in Ghana through this technical assistance that we provided and very innovative partnership, local-led capacity building with another local organization in Ghana. Thank you very much. I hand it over to you, Mary.
Thank you so much, Joseph, for sharing your success story with us. So next, we invite Richard from Casapreco Company Limited to share his presentation. So over to you, Richard.
Hello, Mary, and thank you, Joseph, for this. So I am Richard Ajay, the Managing Director for Casapreco, and I'll be talking about our collaboration with TFHO and Casapreco on how we came up with the hand sanitizers. Can move to the next slide. Okay, so as Joseph said, COVID hit Ghana in March 2020, and sanitizers became very scarce in Ghana and also globally. Prices of sanitizer for 200 ml bottle had shot up from 5 cedis to 25 cedis over a very short period of time. And people couldn't even get some to buy. There was a day that the president called many industrial players and asked for support and innovative ways in which the industry can support Ghana in terms of production of sanitizers, face masks, and many other PPEs. Casapreco being the single largest user of ethanol in Ghana and having quite a massive production facility, one of our lines could produce about 100,000 bottles a day of alcoholic products. Based on the scarcity and our capacity, we took upon ourselves to stop one of our lines that we generally use for alcoholic products and convert it into producing sanitizers in April 2020. This was a collaboration with TFHO that we contacted. They came in and supported us with R&D, supported us with the formulation, also supported us with the name. They worked with us in terms of branding, marketing, and when we launched, we were generally using basically the same bottles we were using for alcoholic products and the same closures. But the closures obviously pose a challenge for consumers dispensing the sanitizer into their hands. So we got a grant from TFHO that helped us procure better closures for the sanitizers. And also we use part of the money as well to increase our labor because the closures of this nature had to be done manually. TFHO also gave us a contract to produce custom branded sanitizers for them, which was called the TF hand sanitizers. They also helped us contact some large hospitals and pharmaceuticals to supply our sanitizers to them. They also served on a committee that was between GZI and Caltech. So Caltech is our subsidiary that owns about 7,000 acres of land of cassava. And we have a plant over there that converts the cassava into ethanol. And during these trying times, we had to produce more ethanol. So the team with GZI and TFHO sat down and looked at ways to incentivize the local populace to increase farming, to train them on how to increase the cultivation of the cassava, and also train our staff as well on how to manage the plant better to increase efficiency and therefore more ethanol for our production. And by the close of 2020, Casapreco had supplied more than 8 million bottles of sanitizers into Ghana. And our sanitizers were selling at basically break even at 3 cities. So we pushed a lot of companies that were even hoarding the sanitizers and pushed them to sell their sanitizers and also bring down their prices. That was very ridiculous in the peak of the pandemic. So for us, the achievements mainly were from the time we got the idea and contacted TFHO. We were able to launch within 2 weeks, which was very fast. We were able to distribute our sanitizers across the nation mainly, we did that through our distributors that were already selling our beverage products, and new distributors or new customers that were also interested in purchasing our sanitizers to distribute across the nation. After we started, we also noticed that other beverage companies that were our competitors had also decided to also move into sanitizer, which was all good for the nation, because we generally, as an industry, increase the supply of sanitizers within the country. So employees were trained in a new sector as sanitizer going into being used as a healthcare product was new for us. So our employees were trained, and we also got to learn a lot of new distribution ways to reach pharmacies and places where sanitizers were sold that our distribution channels were not before. And for us as a corporate brand, this was a big move for us because we won the hearts of the nation. We are generally known to be producing liquor, so maybe not very positive in some ways, but the sanitizer gave us a very positive brand image in Ghana. So that was our collaboration with TFHO in Ghana, and we thank them for the support so far.
Yes, so thank you so much, Richard, for providing some insights on how the support from TFHO had impacted on your organizational performance and capacity. And thank you both. So I have a couple of questions I would like to ask you both to gain some more information. But first, let me talk to TFHO. So for Joseph, how did you go about identifying activities to conduct with Casapreco? If you can also share with us how Casapreco was involved in co-designing these interventions. Over to you, Joseph.
All right, thank you very much, Mary. As I mentioned earlier, when we reached out to Casapreco, they were already also in the process of trying to do something in response. So it was a very good convergence point for us. So together, we work together to identify the various things that are needed. So they clearly told us what their needs are, and then we offered and extended the support to them. Even when it comes to developing the brand and then the advertising and everything, we had a discussion with them. They went ahead, developed their brands. We supported the funding, and on the type of radio stations and TV stations they should be aired, we had their inputs on them together, and then together we worked to ensure this happened. Thank you very much, Mary.
Thank you so much, Joseph, for sharing that insight. And I'm going to turn it over to Richard. If you can also share with us what sustainability measures you put in place to ensure capacity strengthening activities resulted in lasting improvements.
Okay, so for us, as I said initially, the training was very key for us, especially with our R&D team, making sure that we produce the sanitizers that are WHO certified. We also went into the cassava side to train the cassava farmers to make sure they are producing or they are farming efficiently, to make sure we are getting the ethanol that we need for the sanitizers production. For us as well, we've also dedicated the line that we're using to produce sanitizers anytime there's demand for us. Part of our distribution chain has also been changed to focus mainly on the sanitizer side, to reach out to the pharmaceuticals and hospitals in our side.
Thank you so much, Richard. And then I'm going to ask Joseph, what were the measures that you put in place to also ensure you are able to sustain this improvement that you have given to Casapreco?
Mary, and having a market, it's a very important step to sustainability and to ensure that KCL will be in production. So right from the beginning, we contracted KCL to provide for us a social marketing brand, so that even if KCL struggles with their brand, we have a social marketing brand that might be supported by a donor, which will be able to serve certain parts of the market that is needed. So that was one very major step. The second was working with partners to build demand and still educate the populace about the need for hand sanitizers, that even beyond the COVID scare, hand sanitizers should become part of our first aid kit, of our essential health commodities kit that people can always use. And this creates a market and ensures that investment in KCL does not go down the drain. Thank you very much, Mary.
Thank you so much, Joseph. Finally, I have one question for you, Joseph. If you can share with us mechanisms that you have put in place for ongoing technical support and coaching. Over to you, Joseph.
Okay, so the mechanisms in place is continuous partnerships and maintaining the relationship with KCL. And because we are also having a product manufactured for us by KCL on contract manufacturing, any improvements, any modifications we bring in the products, we will pass that on to KCL to help technically improve the product and make it available. However, we are looking beyond this space only and looking at exploring other things that we can do with KCL. They are a beverage company, about the largest local one in Ghana, and probably there are lots of opportunities in nutrition that can help, and it's one of the areas we are exploring. But the first thing, we are maintaining the relationship, nurturing it, and hoping that a lot more comes out of this relationship. Thank you very much.
So thank you all, our panelists. Now I would like to take some questions from our audience. And we have the first question to begin with. To all panelists, if you can highlight what was different about delivering or receiving locally led capacity strengthening versus capacity strengthening delivered by an international organization. or NGO. If you can share with us what the relationship was during the partnership and then the results. Yeah, so maybe Joseph, you can take the lead.
Okay, so I think the partnership, we've spoken about it at length. The results, I think, has resulted in the production of a social marketing brand. It has also resulted in a commercial brand. As Richard said, over 8 million bottles of hand sanitizers have been produced. And if each bottle is 200 ml, that should tell you the volume, the liters of hand sanitizers that have been produced on the market. That is impact of this. I believe in the supply chain, there's a lot of benefit that has happened. Packaging has come in, labels, production of labels, socially on the market has come in to help, and even employment along the value chain amongst those who sell, and even at the factory level, producing this is some of the impacts that we can talk about what this partnership has yielded. Thank you very much.
So thank you, Joseph. Maybe I'll turn it over to Alpha, if you can share that difference, getting capacity strengthening from a local partner or an international NGO. Over to you, Joseph. Alpha,
Thank
sorry.
you, Mary. Thank you, Mary. I think for us, the key thing was the fact that we were building capacity to local CSOs and worthy groups. The fact that we understand the environment, the economic situation of the areas that every group is operating. To me, that was a bit easier and impactful, in a sense of the fact that 90% of the worthy group members are women, and mostly are housewives. So for us, coming with the capacity building and technical assistance for them to be able to develop a business plan, to capacitate them with the marketing knowledge, sales knowledge, and being able to produce locally and take the product to the market and sell. For us, it's a big achievement in a sense of improving the economic situation of the family, but from the fact that you know, these are the housewives, the mothers in the family. So even empowering women as empowering women from the socio-economic dependence. So to me, that was very impactful. Yeah.
Thank you, Alpha. And for Richard and Joven, if you can also share with us the difference between this locally led capacity strengthening approach versus capacity strengthening that has been done with international NGOs or donors. If you can share with us what those differences are. Richard?
Okay, so from my side, I believe that the local side, because they know the market, for us, it was very helpful. I believe for us as a business, we are more profit-led. So to work with TFHO, that was more non-profit organization in terms of mindset, was very helpful to make sure that we change our mindset from a profit-oriented company to a more of a non-profit oriented company based on this particular product, was very helpful. They also know the market in terms of the communities that really need help. We did not know such markets. So that was also very helpful for us, they being local in Ghana. They also helped us a lot in our distribution chain, where the product is needed, even in the South cities and the bigger cities. So I'll say that locally, because of their local know-how, it did help us a lot. And in terms of timing, I believe anytime we called on them, Joseph would be in our office very early in the morning to support our team. Their teams were here in the R&D office day to day, helping us to formulate. So the timeliness was also very key for us.
Thank you so much. So maybe I'll turn it over to Joven, if you can also share those differences between the locally led capacity strengthening approach versus one done with International NGO.
Yeah,
Joven.
sure. The same as others have said, but for us, we look at the angle of the sustainability, because the local capacity or partnership from the local organizations, we have learned that there is a lot of sustainability when it is led by the local partner. Why? Because the whole process of identifying, implementing, and also, for example, starting production, it was based on the need of the community itself. So we did need assessment at the local level, is where the T-MARC now picked up to start building up the capacity. They looked at the PASADA itself, they identified the need or what they needed to strengthen their capacity. And from there, they went over to the WSET groups to identifying those needs at them. So when we were addressing or building capacity, we are trying to address those needs which are on the ground. And that's why we find that this group, they're still doing well. They're still addressing the challenge, even though we may say that the pandemic is no longer so strong the way it was, but there's still these people producing, they're still producing anti-wash, they're still using tailoring, producing anti-mask, and sometimes doing other side business related to that. So if you look even at their business plan, their business plan also we are looking at what we are designed in the project. But there was a room to adjust if there is other need can be accommodated within that one. So you'll find out, basing on that, the sustainability continues to this group, and the PASADA itself. Now we are able to saying that for our ESLOs and livelihood volunteers, the livelihood volunteering, they can even go to teach to others, or they can cascade the knowledge they have acquired from that one. With the guidance with the T-MARC, the Alpha have said it well, that time to time we visit each other, we call each other for, because even though the project have gone to the end, but you can still work together in some areas, the same areas or different areas on that one. Thank you.
Thank you so much, Joven. I still have a question for Alpha and Joven. If you can share with us, where did the capital come from to carry out the activities that you described? Alpha?
Thanks, Mary. We got a grant from NPI Expand to provide the technical assistance in business planning and marketing to 25 WSET groups in the country, which were supervised or which were under 3 CSOs: PASADA, MOXO, and NAFGEN, as I mentioned earlier. So from the grant is where we were able to design the training, to design the training curriculum, to develop training materials, to identify needs in the society, in these groups and in the CSOs, and we're able to develop all the intervention that I've mentioned and all what Joven has said. So we got a grant from NPI Expand Palladium to conduct that.
Thank you, Alpha. Joven, if you can also share with us where the capital came from to carry out the activities that you just described?
Yeah, the same. We received a grant from NPI Expand Palladium, and we were supported day to day on the production, since we are addressing or we are implementing based on milestone. So it was when you complete a certain milestone, the Palladium will sign with you another grant to address a follow-up activity and the milestone. So we received the grant from NPI Expand.
Thank you so much, Alpha and Joven. So there's a question for Joseph and Richard. If you can also share with us, you spoke about a very interesting market shaping initiative. Do you see an opportunity for this type of activity in other health areas or health commodities? Richard.
Okay, so from what Joseph has hinted, we are a beverage company. So certainly anything into nutrition is something that we can look at in the future, or anything into the food sector that is more of a non-profit supports we can look at in the future for us. So we are very open to working with TFHO in the near future in other sectors, not only the sanitizer side.
So just
Thank you,
to
Richard.
add, yeah, thank you very much, Mary. And just to add to what Richard said, beyond KCL, yes, I would say that this can be replicated in other health areas. And maybe on another webinar, we'll get opportunity to share something that we've started also with a local pharmaceutical company, where we're working with a local pharmaceutical company to also bring out a very essential health commodity in Ghana, so that we become self-reliant on that commodity and not import that commodity into the country. So I believe these lessons can spread beyond other sectors in health and can bring in various partners to be able to bring more of these, to build local capacity to meet our needs. Thank you very much.
Thank you so much, Richard and Joseph. We have two more questions for all our panelists, then we can wrap up from here. So the first is, how has inclusive development and aspects of diversity, equity, inclusion, and accessibility intersected with your implementation efforts? Maybe I'll start with Joseph.
All the words in there actually got me confused in terms of equity, accessibility, everything. So all I would say is that, yes, all of that came in and converged at a point. We factored all of that into the process. And to address equity, inclusivity, you look at how we worked with KCL, inclusive throughout. How we even designed and improved the product, inclusive, because we had to hear from the consumers. What is it about the cup that you don't like? What can we change about the cup? It brought it in. Equity, I believe, was one of the greatest things we offered, because to date, Casapreco sells at just break-even point, the lowest priced hand sanitizer, and is able to produce large quantities and distribute effectively to all parts of the country, not just in urban areas. Thank you very, very much.
Okay, then I'll turn it over to Richard. If you can also share with us, how inclusive was this in terms of diversity, equity, inclusion, and accessibility?
Okay, so I think on the working relationship side, Joseph has touched on it. That was very inclusive. We collaborated quite a bit. But from the market side, I'll say that we got hundreds and hundreds of mothers actually coming to buy sanitizers from us and make a business from it. So that was very, in terms of bringing in women into the equation, that was something that we were very proud of. So other than our distribution chain, a lot of the people that came into our factory during the pandemic were mainly women, that were looking to make a living, even from the sales of sanitizers. So for me, that was quite touching from our side.
Yeah, thank you so much, Richard. And I guess the women that were involved in cassava farming also created a source of revenue for these women as well. So I'll turn it over to Alpha and Jovin to share their thoughts on this.
Thanks, Mary. As I said earlier, that fortunately enough for us, the 90% of the Wathietu group members are women, and members were engaged and participated in various way, especially I'll say throughout the process of designing the interventions to a production and to taking what they have produced in the market. And one thing that I've noticed during this project, I was impressed with the confidence and how good women are in selling the product. You know, whenever you're taking a new product in the market and it is local made by a group of women in a small room, it's difficult to sell. But I could see, you know, the passion and the dedication of these women in selling this brand, the ownership of these women toward the brand, the feeling that this is our brand and we need to make it excel in the market. So I was very much impressed with their passion and the way they were able, you know, to deal with the fast rejection when you're taking your product to the market, when they were not giving up, coming up for the second time and third time. I remember was talking to one of the women and said, you know what, I've learned you need to do like 5 rounds of call to get your product purchased by a customer. And I said to myself, wow, I'm impressed by this. So it was inclusive, and we're proud with the way women have responded to this. And honestly, as someone was facilitating the project, I'm super happy with the way the women did justice to the project. Yeah.
Thank you, Alpha. And then finally, Joven, if you can share your thoughts on this.
Yes, to add on what Alpha have said, yeah, the area where the project was operating is a Muslim-dominated area, and you can understand now some of religious issues. We PASADA, we are Catholic, but we are working with all people, regardless of the age, background, and whatever. But at the same time, Dar es Salaam city is you have some urban setting and some rural setting. You may find that there is a kind of diversity, but all this were taken care by the project. But because due selection of the Wathietu groups, we were mixed. Some were coming some sub-rural and some coming from urban setting. So all of them, they are sitting together. But to address the diversity also, during the planning, all of them were coming together, taking the issues together, taking the idea together, and then they come able to address it. As Alpha said, that many of our group are dominated by female, by women, but also I've said also that there is the issue of literacy. Some of them were not, they don't know how to read and write. According to the model of Wathietu, there is some curriculum to be taught during the meeting of these Wathietu groups. So through that mode of training, how to read and write and all of this, it will able to address the diversity. But there is also issue of economic levels. The same, the group, you find some people, they differ on income. Some they have some income, high income, and some they have nothing really. But when they come on sharing, they share equally, or they help those who are in more need in those groups. So by using that model, we were able to address the diversity which can be or can occur during the implementation. Thank you.
Thank you so much. So I have my final question for all panelists, and to wrap up. So if you can share with us what the key lessons you have learned through implementation that you would like to share with us. Alpha?
Sorry, Mary, come again. I didn't get you.
Yes, so my final question is for you to share with us some key lessons you have learned through implementation that you want us to know.
Oh, well, thanks, Mary. Mine, I'll summarize them into three. One is there is a high need of women empowerment in our society, especially as how Jovin has mentioned. We have lots of women with our society is mixed up of people with different beliefs and different settings, urban and peri-urban, looking at specifically for PASADA. But however, these women for such a long time, they have not been given opportunity or chances to involve themselves in economic development activities. So there is a chance of for us to continue empowering women, especially in the suburbs, in peri-urban, where we really had difficulties even to organize them for training. The second thing for me is I see a big opportunity around developing whatever the Worth It groups have produced and what they are doing right now. Yeah. Yes, because we're doing it locally. Yeah, there are issues around branding and qualities that need to be addressed. And from where I'm sitting, I can still continue supporting them by giving them advice on what to do and how to go about it. But really, if you want to have are consistent in terms of quality and branding, we really need to invest around a production machine or line that can deliver for the groups quality product that we are talking. And of course, it will be easy to monitor the quality and ensure the branding. Lastly, for me, is the support behind the brand. Now we need. I think there is an opportunity to grow the brand. Looking at the market, for instance, if I look at the Dar es Salaam market, there is a huge opportunity with the hand wash liquid soap. So if we can support, we can invest behind the Pomona brand. There is a chance for it to grow and become a leader in the Dar es Salaam market. Thanks, Mary.
Thank you. So Joven, your final thoughts?
Yeah, for us, many have said it well, but we can, for us, for PASADA, we can record or we can comment on formalization of this the group activities. When you formalize the activities conducted by these groups, you ensure the sustainability. Since now they were trained in hand wash production, mask production. This group have now focused on producing those activities and they are known by the members. If there is these retail sellers, they go direct to buy from them because they are known. But the income generation have increased from this one because they used to produce locally, but now after formalization, they can record high level of profit. Not only that, but we gave few members of the group the skills. But now, if I now during the production, for example, production of the soap, all members of the group are participating. That one is well recommended, and we say formalization. And also, they are known by the government, recognized by the government. They have been registered by the government. That is what we can say. It was good left by the project. Thank you.
Thank you, Joven. Richard, key lessons learned through implementation. Richard.
Okay, so from my side, I'll say that even as a country, the lessons that we should learn from this whole pandemic thing is how prepared are we as a country, as a nation, for other pandemics that may happen, especially when we come to the subject of import substitution. In this pandemic, the country were hit with shortages in hand sanitizers, face masks, and all of these things. But in the future, which other areas should we be prepared for? As a country, we are very dependent on importation of rice. A lot of our food is still being imported. There may be a pandemic in another country, China or wherever, that may affect us getting some of these foods into our country. As a nation, we really need to look at making sure we have a majority of key items produced locally. And for me, that's the biggest lessons that I've learned within this pandemic period.
Thank you. And finally, Joseph, if you can share some key lessons.
Well, thank you very much. I believe my colleagues have shared all the lessons. I would just add one more to it. The only thing I would say is that local partnerships work. And from all the examples we've seen, yes, local partnerships work. They work to achieve the inclusiveness, the diversity, the equity, and all that we want to measure. So for me as a key lesson, my takeaway is that local partnerships work, and we should keep identifying local problems we have, and the solutions can be found locally through partnerships with local organizations. Thank you very much.
So thank you so much for joining today's webinar, The Way Forward, Locally Led Capacity Building Approaches. And apologies if we were not able to answer your questions, but we hope you benefited from the discussions. And thanks to our speakers, our panelists, and our organizers who helped make the webinar possible, especially Ariela Camara, Laura Wenzel, and Cindy Hodo from USAID, and then Samantha Lemay, Elizabeth Neeson, Jeff Barnes, and Michaela Neeson from MPI Expand. We hope that with today's session, you have more insights on the value of locally led capacity strengthening. If you have feedback or suggestions for us, please use the link that we posted in the final slide, and have a great day. We hope to see you at our next webinar coming soon. Thank you very much.
Thank you very much.
Thank you. Cheers.